Axialis is a radiofrequency treatment and can be used to treat skin laxity. So predominantly we utilize that over the facial regions as well as the neck. It is very useful for treating around thin skin areas such as around the periorbital zone and also under the neck as well. So Axialis basically is a radiofrequency device, and all radiofrequency devices work by heating up collagen bundles. So what happens is that the device will go over the skin in a dynamic movement, and in the process heat up the underlying skin and trigger the collagen to tighten in this process. For Axialis to work well, it needs to hit a certain temperature point. Usually, radiofrequency works best between 40 to 41 degrees or so, but it's very important that we do not burn the skin as well. At the same time, the therapist has to take note of any underlying patient discomfort and get real-time feedback from the patient. If the patient feels it too hot, they need to move away from that location. Immediately after treatment, you will usually feel some warmth. There is no surface downtime expected because it doesn't break the skin. What you can see is almost immediate results because radiofrequency heats up collagen and causes immediate tightening. So there are almost instantaneous results that you can see as the skin is firm in the area of treatment. Now, the key thing is to sustain the improvement results and build on that over time. So this process needs to be repeated every few weeks, and then over time, over months, you will see a more permanent lasting improvement. Now, Axialis is oftentimes used to treat important areas such as the face and the neck, but it can also be used to treat off-body locations. Now, if you have some laxity over the tummy area or other locations, you can also employ Axialis radiofrequency to these areas as well. But it's really popular for treating certain areas such as the periorbital zone. As we know, the skin there is very lax and usually shows early signs of aging as one of the most important areas that we need to treat. So typically, it is oftentimes asked or requested for the periorbital rejuvenation, but can be actually utilized on body sites as well. In terms of number of sessions, usually again it depends on the severity of the laxity. Usually within 1 or 2 sessions you will start to see improvement, but if this is completely the mainstay treatment that is being utilized, I would say maintaining it once every month to 2 months is a very nice procedure. Results do not last forever, unfortunately, as all things do. As we try to push and improve skin laxity and skin quality improvement, time works against us, intrinsic aging works against us, gravity works against us. So even though we heat up and the collagen tightens, over time, laxity will start again. So as a result, I always say that it's important to stay on top of the improvement and build on that, rather than to do a treatment and then not follow up for many months as well. So if you want a good build-up of results, do perhaps look at doing it once every 3 to 4 weeks for a number of months, and then subsequently lengthen the duration of treatments in between to about maybe 3 to 4 months once, just to keep things sustained. Yes, the treatment is mostly safe. Again, it is important to choose to have this treatment done in a very safe setting. So go to a practice that has well-trained therapists who can manage your skin type well. This is also best done under medical supervision because it is important to choose the right profile of patients. For example, if you are doing radiofrequency to the face, because it is a treatment that delivers heat to the skin, it might not be suitable for certain patients with underlying pigmentary conditions such as melasma. It can cause melasma to surface more and cause darkening of that condition. There is no real downtime with radiofrequency treatment. In fact, your skin actually looks firmer and tighter the very same day itself. So it is just important to keep on regular good skincare, just put on moisturizers, and then avoid any harsh topicals to the skin for maybe a couple of days.